Hello everyone, so in this video we're going to be talking about palpating a pulse, recording heart rate, recording peripheral saturations of oxygen, and we're also going to be introducing our OBS machines to you. These are Welch-Allyn OBS machines. They help us record vital signs. These OBS machines we use at West Hospital also connect to our electronic patient record, so when you record the observations on here they get uploaded to the electronic record called eCare straight away, so you can view all the patient's vital signs and they'll put them in an OBS chart for you. There are about 1 billion different OBS machines around the world, so we can't show you every single one, but they all follow a basic principle of turn it on, press go to record the blood pressure, put a SATS probe on, and then silence it when it alarms. Really.
Or you do something about it.
Do something about it. Yeah. So this OBS machine in itself you need to sign into first when you do that. Now, if you're really fancy like me, you get a little barcode, which you probably won't, to scan. But if you don't have that barcode, you can put in your username, which you'll be given when you start here. So my username is TOW. Okay, once you've done that and signed in, it will then ask you what you want to do, and we want to record someone's vital signs. So we're going to click on that part, and then it's going to ask us to scan the patient's ID. So each patient will be, like Tina is demonstrating, wonderful, have a wristband on which has a barcode on it. It also has a QR code, but a barcode is what we want. And we want to use this scanner on the side of here to capture that barcode, and then it will record that patient on here so we'll know that we've got the right patient. It's important to point out that before you do any procedure on a patient, it's really important that you introduce yourself to the patient. So I would want to make sure they introduce themselves, say, hi, my name's Tom, also say your role, make sure that they know why you're there and that they understand what it is that you're going to be doing and that you gain consent for actually doing that. So I would make sure, hi, my name's Tom, I'm a nurse, I'm here to record your vital signs, which is your blood pressure, pulse, respirations, SATs and temperature. Is that okay if I do that?
Sure, fine.
So I've got all the things that I need, and then once you've done that, to make sure that you identify that this is the person you're meant to be doing this on. So I've scanned this person, so I know this is the correct person here, and so I'm going to continue to record the observations that I need to. So if I want to record the saturations of oxygen of this patient, I'm going to need to use a SATS probe, which is attached to the side of the OBS machine. This SATS probe is essentially a finger probe that if you squeeze the end, it opens up, and you can see there's a little red light inside there. That will shine a light through the finger, and what it's going to record is the amount of red blood cells that are saturated with oxygen. And most humans, hover between 94 to 98. So we want to be able to put it on the patient's finger. So if we are going to do that, we need to make sure that the fingers are warm and well perfused. So before you record it, you can squeeze the finger very gently for 5 seconds at the height of the heart, and then see if the colour returns to the finger within 2 seconds. If that happens, then you know the patient's well perfused, and then you can place the SATS probe onto the finger.
So along the same lines there, Tom, so if someone's wearing nail varnish as well, or big acrylic nails, that can affect the results.
It really, really can. So sometimes you might need to remove that nail varnish. It's important to also understand that if your patient has got a bit of a low blood pressure, if they're cold, they might not have a good blood supply to their hands, so it might not record the saturations of oxygen accurately. So it's important to figure that out. People do decide to try and use these SATS probes in weird ways, like they try to record on the ear or the toe. They're not really designed to do that. It is possible technically, but they're meant to be used on the finger, so that's where we're meant to be recording it. As you can see, that Tina's saturation of oxygen are 97%, which is great. She's very healthy. You can alter the machine to look at the waveform that the pulse is creating, and you can see that that's a really healthy waveform there. So we're really happy with what we're recording. We know it's accurate, and then we can write that down. Alongside her saturation of oxygen, you can see that you've also got Tina's pulse rate or her heart rate. And we can see because Tina is incredibly fit and healthy and runs all the time, her heart rate is a really healthy 50 to 48 it was earlier. So we can also write that down as well. Another thing another way to record someone's heart rate is actually probably arguably a better way, is to actually palpate the pulse manually, which we would encourage you to do every time you do a set of vital signs for the patient. The pulse that we generally palpate is actually the radial pulse, which is over here underneath the thumb on your wrist. And we want to be able to make sure the hand is well supported, that we're not holding it too high, because then we might get a good feel of the pulse. And we want to place our fingers there, and we want to just feel for the pulse, and then record that pulse over a full minute. And just count every time you feel the pulse there. There are other pulses that you can feel. For instance, you've got a brachial pulse that you can feel in the arm up here. You've got a carotid pulse, which you can feel here. There's a temporal pulse. There's femorals, there's popliteals, there's dorsus pedis, posterior tibia. There's all sorts of different pulses all over the patient's body. What we'd encourage you to do is, before you attend the lesson, is just have a little feel of, you know, a close friend's pulses, just to see, so you can get used to feeling all these different pulses. Have a look at the internet, see if you can work out where to do that. See if you can actually feel some alternate places to feel someone's pulse. If we're feeling someone's peripheral pulses, so the ones in their feet, the ones in the temporal artery, the ones in the wrists, if we get a good idea, we can tell, if we can feel the pulses there, we know that the patient's well perfused and they've got a good blood supply to all over their body. If we can't feel the pulses in those places, we might think about feeling a more central pulse, like a carotid pulse or a femoral pulse. If that's the case, your patient might not be very well, and then that will all play part in the blood pressure and working out how well the patient is. So that's the locations. When you are feeling the pulse, it's also important to note a few other things. So, for instance, the feel of the pulse. Is it weak, what we might call thready? Is it bounding, so it's a really bounding pulse? Is it regular or is it irregular? And if it is irregular, is there a pattern to it? So beep, 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 miss, beep, 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 miss, something like that. So those are important things to actually think about when we're feeling the pulse and recording the pulse. Okay, anything I've forgotten?
No, just saying if the pulse is irregular, it might sometimes pick up on the machine, so the pulse rate just might be a bit all over the place, and you'll see it where Tom pressed earlier on the trace. If there's any doubt, just have a good feel of the pulse as well.
Okay, thank you very much.
Thank you.